Hello, and welcome to today's daily psychiatry study session. I'm thrilled you've joined me again, taking this intentional time to nurture your curiosity about the complexities of mental health. Each session like this is a step forward in your journey, building layers of insight that will serve you well. Remember, learning is a gentle process. Let's approach it with kindness toward ourselves and an open heart. You're already making progress just by being here. Today, we're exploring schizophrenia, a key psychotic disorder that involves disruptions in thought, perception, and emotion. Let's break it down with three essential key points to enhance your understanding. First key point: the diagnostic criteria and core symptom domains. Schizophrenia is diagnosed when a person experiences at least two of the following symptoms for a significant portion of time during a 1 month period, with some signs persisting for at least 6 months. Delusions, fixed false beliefs like paranoia or grandiosity, hallucinations, often auditory, such as hearing voices commenting on actions, disorganized speech, tangential or incoherent thoughts, grossly disorganized or catatonic behavior, and negative symptoms, diminished emotional expression, avolition, or social withdrawal. At least one symptom must be delusions, hallucinations, or disorganized speech. These must cause significant social or occupational dysfunction and not be due to substances, medical conditions, or another disorder. A useful mnemonic is delusions hallucinate disorganized negative, or DHDN, to recall the categories. Clinically, early detection is crucial. Prodromal phases may show subtle changes, like social isolation or odd beliefs before full onset, typically in late adolescence or early adulthood. Second key point: subtypes, course, and associated features. While the DSM 5 moved away from traditional subtypes like paranoid or catatonic, understanding variations remains helpful. Paranoid type emphasizes delusions and hallucinations with preserved cognition, while disorganized type highlights chaotic speech and behavior. The course is often chronic, with episodes of acute psychosis interspersed with periods of residual symptoms. About one-third achieve good recovery, one-third have moderate impairment, and one-third experience severe disability. Positive symptoms, hallucinations, delusions, tend to respond better to treatment than negative ones, apathy, flat affect. Comorbidities are common, including substance use, especially nicotine with up to 80% prevalence, depression, increasing suicide risk to about 5 to 10%, and medical issues like metabolic syndrome from medications or lifestyle factors. A clinical tip: always assess for schizoaffective disorder if prominent mood symptoms coexist, or schizophreniform if symptoms last less than 6 months but more than one. Third key point: treatment approaches and management strategies. Treatment emphasizes antipsychotics as the cornerstone, with second generation agents like risperidone, olanzapine, or aripiprazole preferred for their lower extrapyramidal side effect risk, though monitoring for weight gain and metabolic changes is essential. First generation options like haloperidol are used for rapid control in acute settings but carry higher tardive dyskinesia risk. Psychosocial interventions are vital. Cognitive behavioral therapy for psychosis, CBTp, helps manage persistent delusions or hallucinations by challenging distorted thoughts, while social skills training addresses negative symptoms and improves functioning. Family education and support reduce relapse rates by fostering understanding and early intervention. For treatment-resistant schizophrenia, about 30% of cases, clozapine is the gold standard, requiring blood monitoring for a granulocytosis but offering superior efficacy. Acute management in emergencies may involve hospitalization for safety, especially with command hallucinations or agitation. Long-term rehabilitation programs focusing on vocational and independent living skills promote recovery. With comprehensive care, many individuals lead fulfilling lives. Emphasizing hope and adherence is key. You've just absorbed valuable insights into schizophrenia, strengthening your foundation in psychotic disorders. Pause for a breath and reflect. Maybe jot down one symptom domain or treatment pearl that stood out. These reflections turn information into lasting knowledge. You're cultivating expertise with every session, and that's something to feel truly empowered by. Keep up this wonderful momentum. Tomorrow's topic awaits. Until then, trust in your growth. You're amazing.